Hello, everyone, and welcome to part two of our three-part series in the deleterious effect of stress on adults and the mitigation strategies to reduce that stress and restore wellness. If you remember from before, part one, we looked at the effects of stress. This will be part two, which is going to take a look at the mitigation strategies that can hopefully reduce stress for us. So, a little review we saw this within the last presentation as well. What's the course all about? Well, there's three parts to it. The vision for all three parts is that we want to improve the quality of life in the working adults by lowering chronic stress. So, what's the mission behind that? We want to implement these stress reducing solutions so that they can improve the well being and the health of the working adults through lowering chronic stress. The principles that are going to guide us are being able to identify stress. So, what are the stressors in your life? How do we identify stress? So, stress identification. Mitigation strategies to reduce stress via education. That's what this part two is going to be about, educating you on different strategies to mitigate stress. And then part three, which won't be today, but we will get to it, is going to be the restoration of wellness and how all of these things tie together to live a happier, healthier, more productive life. So, our research foci as we continue to move through this three-part series is the deleterious effects of chronic stress. We did the effects of chronic stress in part one. Today, part two, the mitigation strategies to reduce stress. And then later will be part three, the restoration of wellness. So why mitigation strategies? What are we looking at? What do we want to? What's the purpose behind this? Well, we want to be able to live a happier, healthier, more productive life through lowering chronic stress. We do that by learning and implementing these mitigation strategies. Our ultimate goal is we want to find a way to have a balanced life by being resilient under stressful situations and being capable to meet those situations head on. What we're going to look at today, the different types of mitigation strategies. We're going to look at mindfulness-based training. That's gotten a lot of attention in recent years, so we're going to focus on that. We're going to look at diet, exercise, yoga, and art, and how all these different types of mitigation strategies can hopefully help lower stress. So within our focus and these mitigation strategies, it's been found through different studies and research, which we'll go through today, that through participating in mitigation strategies, there's been a reduction in anxiety and also with moderate effect size and improved job satisfaction. So studies by Guadra et al., we're going to get more in depth. We'll look at everything here that's on this page a little bit later. This is just more of an intro for you, things that we're going to look at. So we'll look at more in depth how mitigation strategies improve job satisfaction in people, helped with reduction in anxiety. We're going to learn what NAV is here in the next one. We'll look at NA and NAV, so you'll get a better idea with that. But we're going to take a look at studies by Colgan et al. From 2019 that gave further evidence that displayed a significant indirect group effect in reducing NAV through a change in perceived stress by participating in mindfulness-based practices and trainings, which is one of our mitigation strategies. And again, you might be thinking, well, what are these letters? What do they stand for? We're going to get to that. So we will go through that as we proceed through the presentation. Mitigation strategies we're also going to see today that help to reduce stress through the diet, the exercise, mindfulness-based practice, yoga, art. They found reductions in systolic and diastolic blood pressure. They found that they help take part in controlling weight loss. And even if you're trying to lose weight or maintain your weight, they found evidence to support both. Studies done by Reich et al. 2017 are going to explain how mitigation strategies had a positive impact on cytokine levels. And they can be good, they can be bad with the cytokine inflammatories. We'll take a look at that again as we move forward. And they also found that through these strategies, those people that are in the workforce, there's lesser absenteeism and lesser presenteeism in employers as they move forward. So let's start with the first one. Let's look at mindfulness-based training and mindfulness-based practices. This program, mindfulness-based training, sometimes called mindfulness-based practices, was developed to help patients that were suffering from chronic pain or difficult life conditions. Actually, Dr. John Kabat-Zinn first introduced mindfulness as a type of behavioral medicine The program was developed to help patients, again, as it says here, who were suffering from chronic pain or difficult life conditions. And when we think about mindfulness-based training, mindfulness is basically, to put it in simpler terms, awareness that arises from attending to one's own state, whether it's an external or internal state, and you're actually being present in the moment. You're in a non-judgmental way, and you're with yourself. You're just present in the moment. That's kind of our definition of mindfulness. And it was found through studies by Guadra et al. 2020. They performed a randomized control trial using nurses. And in order to be included in this randomized control trial, the criteria for the nurses, they had to have mild to moderate stress, anxiety, and depression. And all of the participants got randomly assigned either to an intervention group or a control group. The intervention group actually had a 2-hour mindfulness-based training workshop, 4 weeks of self-guided mindfulness-based practice, where the control group did not receive any of this. And at the end of the study, they found that stress, anxiety, depression, mindfulness, and job satisfaction after 8 weeks actually all had improved through this mindfulness-based practice. They also found results that the mindfulness-based training significantly reduced anxiety and had a big increase in job satisfaction. People felt more satisfied at their job and less stressed out. The next part, when we talked about earlier how mindfulness-based training can significantly reduce NAV, that stands for negative affect variability. And NA, you'll see NA, that stands for negative affect. And NAV is negative affect variability. And NA, or negative affect, refers to the undifferentiated distress, and it can produce a wide variety of adversive mood states. It could be anger, self-criticism, anxiety, worry, or just flat out life dissatisfaction. People aren't satisfied with their life. And many of the trait characteristics, such as neuroticism, for example, they're really correlated with negative affect. So negative affect gets associated with higher perceived stress levels. More specifically, think about when a situation is stressful, or you find a situation that you deem as stressful. You might feel overwhelmed and unable to cope, thus being more likely to meet this feeling of unable to cope with negative affect. So due to the nature of these affective responses, it's a determinant as to why individuals might seek relief from stress through participating in healthy or usually unhealthy behaviors. Sometimes they're healthy. Sometimes people deal with it through exercise, which can be good as long as it's not over the top or an excessive amount, because sometimes we can get hooked on that, which is a bad thing. But most of the time, it's usually an unhealthy behavior that someone participates in to deal with these events that we deem stressful within our life. So the reason NA becomes relevant when addressing stress is because the evidence shows that NAV, negative affect variability, which refers to any specific person's variation or standard deviation of negative affect, it's linked to most mood disorders, and it has a positive correlation with the elevation of stress levels. That was found in studies by Colgan et al. 2019. If we look a little bit further here, we've written chronic activation of NAV transforms psychological and physiological stressors into prolonged physiological activation of two systems: the sympathetic adrenal medullary system, or the SAM system. And you might remember this from part 1, the effects of chronic stress. We had mentioned the HPA axis, or the hypothalamic pituitary adrenocortical axis. When those two are simulated, the results can be chronic pathogenic states that lead to various chronic diseases. This becomes a problem. This is where stress ties in with various chronic diseases, which could include hypertension, sleep disturbance, depression, arthritis, respiratory disease, or even dysregulated cortisol levels. If you remember from effects of chronic stress, cortisol, it's that prevailing hormone from the glucocorticoid glucocorticoid group, pardon me, that has a major factor when talking about stress. So how these two systems, again, how they're kind of working together, as we said there, Colgan et al. 2019 conducted a randomized control trial, and they were trying to determine if there was beneficial cognitive effects among stressed middle-aged to older adults as a result of participating in this mindfulness-based training programs. And they had a secondary purpose that went along with this in their randomized control trial, which they were trying to assess if the effects of mindfulness-based training on NAV could be explained in a reduction of perceived stress by the participants within the group. So the results actually revealed that participants in the mindfulness meditation training program significantly reduced NAV compared to those in the control group. And further, their evidence displayed a significant indirect group effect in reducing NAV. And the study supported that mindfulness training really did enhance the well-being in the middle-aged to older adults. The study just basically contributes to the further understanding that mindfulness is a factor in mitigating the harmful effects that chronic stress can put on us. Another one's blood pressure. If we continue down here, it can help lower blood pressure. Currently, when we think of blood pressure, there's a very high percentage of people with hypertension or elevated and uncontrolled blood pressure. And as we know, cardiovascular disease is one of the leading causes of death from non-communicable diseases worldwide. And that's also prevalent in the research done by Solano Lopez here in 2018. So she went further and she conducted a systematic review of randomized control trials to examine all of the literature on mindfulness-based training programs and to look at the effectiveness on blood pressure in adults that have elevated blood pressure or hypertension. A total of 5 reviews got included after all the exclusions, and the studies found that the intervention groups partaking in mindfulness-based training had more reductions in systolic and diastolic blood pressure in comparison to control groups. And that was taken in clinical blood pressure measurements, so nothing at-home measurements, actually in a clinical setting. So there is evidence to support that participating in mindfulness-based training can lower blood pressure. It can also help with weight control and weight loss. And we're going to look at studies here by Chumachenko et al. That was completed in 2021 that's going to show mindfulness-based strategies help control weight loss with lowering stress levels. They conducted a randomized control trial, and their primary focus was to see if there's to improve the understanding of psychological and neural mechanisms that might be modified by mindfulness, and could this predict clinical outcomes for the future. The study consisted of 57 participants, and they were male and female. Everyone was between 25 and 60 years of age, and it was people who intentionally lost 5% body weight in the previous year, or they're trying to maintain their body weight for 2 years, or they're trying to lose weight. So they're trying to do one of the 3 there. And the participants were all randomized in mindfulness-based stress reduction, either a group or a healthy living course group. And the evidence from their study revealed that after 6 months, the mindfulness group those trying to maintain their weight, while the control group displayed a weight gain of 3.4% BMI or body mass index. The study also showed that after 8 weeks, there was a positive change in depression symptoms, which is going to tie in again. That's one of the things that can lead to depression is weight. Sometimes people eat because they're unhealthy, and sometimes people are unhealthy because they eat. Or people eat because they're sad, and they're sad because they eat so much. It's kind of reciprocal. It ties in together, so it can be a vicious cycle. As we look at the last part here, another benefit of mindfulness-based training, the inflammatory cytokines, they kind of act as immune restoration for us here. And we're going to use studies by Reich et al. 2017 to help support this. But a little bit about the inflammatory cytokines before we move forward. You may have never heard the word before. That's fine if you haven't. An inflammatory cytokine sometimes can be called pro-inflammatory cytokine, and it's basically a signaling molecule, and it's made and released, or it's secreted from the immune cells, white blood cells such as hyper T cells, or it could be from macrophages and certain other cell types that promote inflammation. And you're thinking, well, we don't want to promote inflammation. Well, these cytokines, they can be good and they can be bad. They can be good when stimulating an immune system response to possibly fight a foreign pathogen or attack tumors, and they could be bad for us when they cause inflammatory diseases. Things like rheumatoid arthritis, for example, or tumor necrosis factor would be another one when they can be bad for us. So that's kind of what they do. The hope is that they're doing good things for us and stimulating that immune system to fight, foreign pathogens. But either way, it was found that mindfulness-based training appears to positively correlate with levels of these biological stress markers. These are these pro-inflammatory cytokines that we speak of. Reich et al. 2017 performed a randomized control trial using 322 breast cancer survivors, and they were randomized into a 6-week mindfulness-based program or a control group where they just were in their normal, usual care. And the MBSR group, that's the mindfulness-based training group, they did a 6-week version of the Dr. John Kabat-Zinn, which we talked about earlier, the mindfulness-based training. They did a different version of that 8-week program. They did a 6-week program, and the participants would partake in 15 to 45 minutes of mindfulness-based training. Then they also they would do that for at least 6 days a week, sometimes 7 days a week, but a minimum of at least 6 days a week. Those participants also received training manuals for at-home practice, and the results revealed that those within this group had a positive impact on cytokine levels, with an increase in a specific increase in neurosis factor and interleukin-6, which are the good cytokines we want here. So it's having a good role on the cytokines, not the bad role, which we talked about. So all of those things through this mindfulness-based training, which has gained a lot of attention in the last few years, being present in the moment, this mindfulness practice really does help as a mitigation strategy to lower this chronic stress for us. Next one was diet. So when we talk about diet, we know that unresolved stress over time can contribute to many health problems. It could be things such as high blood pressure, heart disease, obesity, diabetes. Restoring wellness through these various techniques and various types of nutrition we're going to put in, it's going to help to counteract bouts of stress, which is essential for living a healthy lifestyle, and that's our goal as we move through here. Cortisol. We talked a little bit about this in the first part, the effects of chronic stress, part 1. And remember, cortisol is the prevailing hormone from the glucocorticoid group, and cortisol helps mobilize the fight against stress because it produces a stable glucose level by stimulating tissue regeneration and inhibiting inflammation process. Factors such as chronic stress, which is our focus here, that leads to long-term constant excessive concentration of cortisol. And this constant excessive concentration of cortisol, that's going to affect the formation of metabolic disorders such as increased blood pressure, insulin resistance, abnormal bone regeneration, collagen synthesis, calcium deficiency. All of this was supported through the studies by Stakowitz and Liebedzinska 2016, as they found that cortisol regulates the usage of diet nutrients by increasing gluconeogenesis and increasing lipolysis via adipose tissue with our fat tissue. So cortisol is increasing protein synthesis in the liver, and it's restricting their formation in skin cells and muscles. The same study done by Stakowitz and Lebedinska 2016 found that cortisol also increases sodium and water retention. It controls adrenaline production in the adrenal medulla. It inhibits inflammatory processes. It provokes euphoria or depression. So all of these things happen based upon cortisol affecting our diet. So let's think about this. During stressful situations, sometimes we have an appetite for fat or sweet meals or snacks. This is most likely due to their rewarding character. And whenever we have a consumption of these types of things for our meals, it induces an increase in cortisol level. Well, we know that we don't want an increase in cortisol level. That relates to our stress. And this response has been strongly marked in both males and females. And findings show that nutrients such as phospholipids, right down here, they may affect the levels of cortisol in a good way. It's a positive thing. Supplementations of nutrients such as phospholipids, which can be found in egg yolks, for example, they can help affect the levels of cortisol in a good way. Aminobutyric acid, also known as GABA, because it's called gamma aminobutyric acid, most easily called as GABA, again, affects levels of cortisol in a good way. These are things within our diet that we get from brown rice, fermented milk products, beans and barley, other nutrients such as vitamin C, plant extracts, fish oil, all are going to help out with affecting levels of cortisol in a positive way. So they're going to help counteract those high levels of cortisol. They're going to help bring them down by eating the right nutrients to go along with it. It's easy sometimes to forget about our diet because as we talked about earlier, when we've been through a stressful situation or depression, things of that nature, we get a sense of euphoria or a rewarding pathway to the brain through eating basically unhealthy high or fatty high palatable foods when we're stressed out. So maintaining this diet, remembering we want to counteract the stress levels of cortisol by getting the right nutrients and by doing that in a positive way. We don't want to reach out to eating. And that eating actually adds to more stress and depression sometimes in people because they're stressed out or they're dealing with anxiety or depression. So they eat maybe something they call a comfort food. You've probably heard of that. This is my comfort food. They eat that comfort food. And then they overindulge in that unhealthy comfort food. And then they feel worse the next day now because they're stressed out because of what they just ate. So that can become a vicious cycle. So understanding the diet and trying to maintain that becomes a good thing. A big one that most people usually know about, obviously, is exercise. And exercise has considerable beneficial effects on cognitive performance on everyone. So in the general population, in the older population, younger population, those that are stressed out, fighting chronic stress, on everyone. Kennedy et al. 2017, within their research, shared that effects of exercise on cognition include improvements in cardiovascular function, increased neurogenesis and neuroplasticity, reduced inflammation, improved insulin activity, reduction in anxiety and stress. Because when an individual is exposed to stress, the SNS system, or the sympathetic nervous system, and the HPA axis, which you've heard before, that's the hypothalamus pituitary adrenal axis, they get activated. And when those two are activated, the SNS releases catecholamines in the form of adrenaline and noradrenaline, and the HPA axis releases glucocorticoids, primarily cortisol, which we talked about. And the reason this can become an issue is the glucocorticoids, when they cross the blood-brain barrier, they're binding with receptors in the amygdala, the frontal lobes, the hippocampus. That's where this talks about cognition, all right? And all of those parts of the brain possess a high receptor density central to cognition. And in contrast, when we looked at what the second system was releasing, and we looked at SNS, that's the catecholamines, and they're not able to cross the blood-brain barrier and influence the brain through activation of the vagus nerve and other signaling pathways to stimulate noradrenergic pathways. This is what Kennedy et al. 2017 is telling us. So what are we talking about here? Basically, we're finding regular aerobic exercise significantly lowers the chance of suffering from stress-associated disorders because the interaction among the two systems, SNS and the HPA axis, they're responsible for the facilitation of a large variety of stress-mediated actions on cognition. Okay, and this could be in individuals experiencing chronic or high levels of stress. They may experience noticeably impaired fluid cognitive performance because those are the things that have a major role in the brain barrier binding receptors in the amygdala, the frontal lobe, and the hippocampus. Again, they possess a higher receptor density central to cognition. So the interaction of these systems, again, they're responsible for the facilitation of how the chronic or high levels of stress are going to influence our cognitive performance. So through regular exercise, if we can lower that, it's going to lower the stress-associated disorders that come with it. It was also found, Kennedy et al. 2017 shared findings from other researchers, Kugler et al. 1994, Greenwood et al. 2012, as they reviewed their research. They found that individuals who were partaking in regular aerobic exercise, and it could be moderate to high intensity, could be just regular aerobic exercise of 20 minutes or more, had reductions in anxiety. They also found, if you look down here at Wheatfleet et al. 2008, because they looked at that research within theirs, they revealed that exercise across all age groups was associated with a reduction in anxiety. So even if we have healthy individuals, everyone experiences some type of stress in their life. That's going to happen. You can't get away from that. It's going to happen. So some stress is good for us, which we talked about in part 1, where if you're driving your car and a deer runs out in front of you, you're going to experience stress, but that stress is going to activate the right things for you to hit your brakes and be okay. So some type of stress, we react to stress in a positive way. Sometimes we don't. But they're finding no matter what, that this randomized control trial, they did, Kennedy et al. 2017 had a meta-analysis of 49 randomized control trials that revealed exercise across all age groups is associated with a reduction in anxiety. And actually, Kennedy et al. 2017 also shared within their findings that voluntary exercise may ameliorate the impacts of stress both psychologically and physiologically. So if a lot of us won't voluntarily exercise. We need a reason to do it, or something that's happening, or being told that we're doing it as part of something. Very few people just get up and voluntarily exercise for the sake of doing it. But they're finding if you do that, it's going to have major impacts on stress psychologically and physiologically. Let's look at yoga. Yoga is becoming increasingly popular and visible in recent years. And that's a good thing, because one of the significant benefits of practicing yoga is obviously stress reduction and relaxation. Other benefits come in the terms of flexibility and elasticity in your muscles, your tendons, your ligaments, things like that. You can perform yoga for strength gain. You can perform yoga for weight loss. We're looking at it strictly from a stress mediating point of view. And Francis and Beamer, 2019, conducted a series of searches to try and understand the relationship between yoga and stress. And their findings revealed that yoga is associated with improved cognitive functioning. And those who were in an 8-week yoga intervention had decreases in negative mood and increases in positive mood. Their findings also revealed that those participants who engaged in 6 weeks of yoga had more confidence in stressful situations, and they had a quicker recovery time from a stressful event. So all of those things beneficial parts to yoga. And again, when we say yoga, there is so many different forms of yoga out there. So you can find any of them that is right for you. If you want a high intensity or a hot yoga class, or one that's strictly for stress reduction and is more meditating or mediation or focuses on breathing, or you want one that is going to burn some calories or give you elasticity, you can find that. There's something out there for everyone, okay, in terms of yoga. One that I found interesting that I know I always loved is art. And Kaimal et al., 2016, they were investigating the impact of visual art making and what it can do on cortisol levels. And the participants within their study recorded their saliva samples that would assess cortisol levels before a 45-minute session of art making, and then they would do it again after a 45-minute session of art making. The participants were also recording their written responses about their art making experience. And what came out of it was a lot of positive results. One, they found that there was lower salivary cortisol at the end of the art making experience than before. Written results from participants said that it was relaxing. It was enjoyable. They were free from constraints. They produced a feeling of losing themselves from all work-related issues. They weren't thinking about work at all. They were just focused on the art. And a lot of them said it promoted a feeling of desire to make art in the future. Here we have the actual testing through the testing of the cortisol, and these are written responses. However, when someone's perceiving something to make them happy or free from constraints or free from work-related issues, and it promotes them to want to come back and do something enjoyable and relaxing and happy again, that's just as powerful to hear those results and how their perception of something is. So that's how art was playing an influence here as a mitigation strategy as well. So when we think about it, in closing, these mindfulness-based practices are really important if we want to mitigate, or not just mindfulness-based practices, the mitigation strategies are really important if we want to lower stress levels. And there, again, there's all types of different techniques out there and strategies we can use. We have the mindfulness-based training, which we talked about. That's just one technique. And there's lots of different aspects to mindfulness-based training. You could do your own class on just the research supporting mindfulness-based training. So we have that. You can exercise. That's usually a big one that most people think about, is the exercise. We had yoga, we have art, we have your diet. All of those things are going to help out. So when we look at over the past 2 decades, stress studies are revealing a negative effect and exposure to chronic stress. And this can be what chronic stress does to the brain, behavior, and cognition. Mitigation strategies to effectively manage and reduce stress are vital. That's why we went over them today. That's what we need to know. We got to not only learn them, but then we have to implement them. So through research-based stress reduction strategies, you can live a happier, healthier, more productive lifestyle, which is our goal. That's what we want to do. How can we mitigate stress to live a happier, healthier, and more productive lifestyle? Everyone's going to experience a stressful situation within their lifetime. Your ultimate goal? Find a balanced life by being resilient under a stressful situation and understanding or knowing how to conquer that situation head on. When you meet a stressful situation, how are we resilient? How do we meet it head on? So mitigating stress helps an individual restore wellness. And having unresolved chronic stress over time, that's going to lead to lots of health problems. As we saw, it could be high blood pressure, heart disease, obesity, diabetes, just to name a few. So restoring wellness through these various techniques described earlier is going to help counteract bouts of stress, and that's going to become essential for living a healthy lifestyle. That's what we want to do. We've identified stressors. Now we've identified techniques we can hopefully utilize to lower the chronic stress in our body.